Hi, I'm Jamie Marbo with Inspired Hygiene. Today's video tip is going to involve connecting the dots in order to have better treatment plan outcomes for your patient. Help them connect the dots as to why we do what we do when they're in the office for that appointment. I'm going to start off with how we can connect the dots with the health history. Simply explaining to the patient why it is important and how the information that is gathered on the health history can actually influence the possible treatment recommendations given by the doctor and or the hygienist. So for instance, if the patient seems to be reluctant or at the front desk when the admin person is asking them to fill out the health history, your front office personnel can say, Mrs. Jones, I know this takes a little extra time, but this is such an important document so that when Jamie gets you back and starts talking to you about it, or when the doctor comes in and does an exam, there are things on this health history that may reveal important choices for the doctor and or the hygienist to make for you. The other thing that can happen is when we're sitting at the chair and we're actually going over the health history with the patient. It's important that we thank the patient for taking the time and being mindful of giving updated answers, because the questions that are in there are sometimes related to the conditions of the mouth. And we want to make sure that when we are discussing this with you, that we make sure we know everything that could be pertinent to the oral health of your mouth as well. So for instance, Mrs. Jones, today I'm also going to ask you some family history questions, because depending on family history, that could have an influence on how we decide to move forward with any treatment that's recommended. We now know that there is a direct correlation between periodontal disease, which is an infection in the mouth, and diabetes, heart disease, blood pressure, high blood pressure. So thank you again, Mrs. Jones, for filling this out thoroughly for me. I appreciate that, and I know the doctor will as well. So try to connect those dots as they're doing things that they seem to be resistant with. Filling out this health history could be all the difference between deciding to move forward with treatment and being a Weight Watcher. Thanks, and make it a great day.